grab one of these handouts and then also a test.
Oh, what are the tests about?
I don't know.
Oh.
Today's 10/8.
Yep. All day long.
Video. Huh? You doing video?
Yeah.
Okay.
Yeah.
Stay over here.
COVID-19. And then there's a handout right here. You want to grab one of these handouts? There's a sign-in sheet. We're gonna start in a little bit here. We'll wait for a couple more minutes. Yeah, I'll grab these and then I'll give it to you guys tomorrow. Yeah, so not waiting. This is the sign-in sheet. And for these signs, this is how you get you guys your CEUs. So each one of these meetings are gonna be one CEU, and so and then I'll add your names on there late a little later. Okay, so what you'll do is you'll just put your name down here. So actually, this is will be your sign-in sheet over right there. Okay, we're gonna start. We're gonna start. So as you know, guys, we usually record the in service, and so people can make it up online or whatever. Today is October 8th, and it's a Tuesday. We're gonna do our in service on viral infections, and there's a couple viral infections that we're interested with. We're interested with the common cold, influenza, RSV, COVID-19, and so it's really hard to tell like what you have when you do get infected in terms of RSV. And I think people try to figure out, what do I have, like in terms of infection. And unfortunately, it's not an easy say like what you have, unless you're able to get a blood draw or some kind of DNA test. Okay. But I have printed this out, guys, kind of tell you like each one of these viruses, what kind of symptoms you'll have for each one. In the back, you'll have COVID, flu, RSV, and in the front, I was able to pick up cold, flu, COVID-19, and RSV. So just the most common symptoms of what you might have in terms of the type of virus. And let's go over this real quick. Hundreds of viruses can fit into one bacteria. So we're dealing with, here in skilled nursing, we're dealing with not only viruses but also bacteria. And one of the main reasons why we wear the N95, guys, when we're dealing with colds and any kind of respiratory, is because these viruses that we're dealing with is a lot bigger. It's a lot smaller than like a bacteria, and so you're gonna need N95 for viruses like COVID-19, because they're so tiny that they're able to slip into a lot of these cracks that you might have in terms of the type of mask that you're wearing. And with the N95 that you're wearing, they're really tight around your face, so it's really hard for these viruses to get in and out. Okay, and the 95 means that 95% of air particulate are being filtered out, so they're not inhaling these viruses. Okay, remember that the more of these viruses you're introduced to, the more load, the more chances you are going to be sick. So you can literally walk into a room from a patient who might be infected, and depending on the amount of viral infection that's kind of floating in the air, is going to determine whether you're sick or not. And also, what's important is that your immunity, right? Your immunity or your ability to fight off infection is going to be significant as well. But take for example, if you have a facility and 99.9% of the people that's in working in that facility is wearing N95, you're going to have less viral load in that unit in comparison to a facility that's not wearing a mask. Okay, so although masks are not 100%, they do decrease your chance of getting infected. Okay,
Actually, I got one here.
there you go. Okay.
Stand back.
Just remember also, viruses needs a host to survive. Okay, it needs a host, and typically 6 to 12 hours on surfaces, so they can live for up to 12 hours on surface. Okay, so and there's entry port for viruses. You can go in your eye, right? Anything that has mucosal membrane, in your mouth, right? And oh, absolutely in your nose. Okay, you inhale it, you get it through your bronchioles, through your lungs, you get pneumonia, certain things, and that's how you typically get these infections, is either through your eyes, mouth, or nose, because they're so tiny, you can get infected through that. Okay. Also, I want to reiterate that when we're calling off sick or whatever, we want to make sure that we're not saying, "Oh, I have the flu," because flu is more significant than the cold. Okay, so flu is the same thing as influenza, but flu, you can have an outbreak in the unit. Okay, you can have all the common colds you want. If you have the colds, um, there's no outbreaks for that, right? It's a common cold, and there's less symptoms for it. But if you have influenza and you start saying you have the flu, right, and there's more significant symptoms for that, right? Patients can die. Patients do die with common cold, but there's more patients dying with influenza than the common cold. So, and the way to get diagnosed is usually it's a viral. The same thing we would do swabs, but it's DNA, RNA, and your doctor or a lab would have to diagnose it. So if you're calling in and saying, "Hey, you know what, my daughter is sick because of a flu," please be very careful saying that, because if you have that, we're gonna automatically say you're gonna get influenza as well. Okay, we're probably not gonna want you to come into work. Okay, at any point in time, if you feel that and your symptoms are significant enough, we might take you off work for 4 days, 5 days, just depending on your symptoms and what's going on in the community. Okay, so remember, a cold is totally different than COVID, it's totally different than influenza, and it's different than RSV. Okay, if you look at this symptom tracker right here, um, the most important thing to kind of remember is that influenza, which is flu, you're gonna have body aches. Okay, for most of the time, you're gonna have fatigue, you're gonna have fever. Okay, sometimes you might have sore throat. Okay, in comparison to a cold, where really your only symptoms here, it might be a sore throat, and you might have some fatigue and might have some aches, but for the most part, influenza is more significant. Okay, and when we have, if we can confirm a case here in Goldberg of 2 cases or more, you're gonna have an outbreak in your unit. Okay, and so we isolate these residents who have influenza for up to 7 days, because you can be sick for 7 days and be spreading these infections for up to 7 days with influenza. Okay, with a cold, they're a little bit less. Okay, you get better much quicker than influenza. Um, so we wanna be very careful when we're using these phrases. We're throwing them around that we're sick with certain viruses. Okay. Um, with COVID-19, guys, some of the most prominent symptoms would be difficulty breathing. These are severe cases. Okay, fatigue and then sore throat. But also with COVID-19, if you look at the other side of this page right here, if you look at COVID-19, uh, you the head with the headache. COVID-19. You ever had COVID-19? You're dizzy and you have headaches. Yeah. You also have a loss of taste. Okay, and a loss of smell, right? With COVID-19, is pretty significant. But when I had COVID-19, I had headaches and I was dizzy. And that's really important, because with any kind of respiratory sickness, you don't have that neurological symptoms. You know what I mean? You get cold, you're not supposed to get headaches. But with COVID-19, it affects your brain, right? And that's pretty significant. You didn't have none of that. Okay, you only had it one time.
Yeah, it was 2022.
Oh, okay, that's good. That's good.
That's when
Yeah,
I think I had my first outbreak.
Yeah.
What, no, it was 21.
So
And
that
I wasn't. The only thing I had, I was fine because I remember calling him.
Yeah.
And he's like, "How do you feel?" I said, "I'm fine. It doesn't even feel like I have anything except for I couldn't taste anything
Yeah.
and my smell, and that was it."
And then with the smell too, that's all neurological. That's all neuro. It's fine to have body ache and all that stuff, but the smell that comes directly from your all neurological. Okay. And so people looking at, okay, how is this COVID-19 going to affect me later on? We don't know. You don't know because it affects your brain as well, right? So, and that's why and most people say, hey, COVID-19 is just a regular cold. Yeah, it is, but it's a lot of it has neural effect. Neural. It's fine to have cold right here in your chest and you're coughing out phlegm, but it starts affecting your smell and dizziness and headaches and all that stuff. It's now affecting your brain. Okay, and that's I think a lot of people don't understand that, but doctors out there and people that specialize with infection, they really talk about that. Like this virus is really significant. Okay, so we got to be careful.
Sometimes I've had people that have it not smell like in the distance.
Yeah, right.
Is their hearing too kind of blows out.
Mm-hmm. Yeah.
Yeah.
So, but for most people don't have symptoms though. Like for you don't have any of the nerve symptoms. For me, every time I had it, I think I had it like 3 times already. I mean, I don't know. I didn't have it when I was a IP infection control nurse while I was taking care of here. But as soon as I stopped working, I ended up picking it up, and then
Oh, I was like,
so I was like dizzy and I couldn't even like I was trying to like walk around at the house and I was like
equilibrium.
Yeah.
Completely off.
So and then you have also guys influenza. A lot of these influenza cases, like I said, we're gonna isolate a resident. That's pretty significant when it comes to influenza here in the facility. RSV, guys, is another one. RSV is one of those viruses that affects mostly the elderly and also the younger, like the infants. Okay, but it can infect people of our ages as well. Okay, we can get them. It's not unheard of, but most people that gets this, especially the infants and the older generations, the main symptoms that's kind of makes it different, that makes it stand out of all these, is that you'll have wheezing. You'll have wheezing with RSV. Okay, you'll have some difficulty breathing with severe cases, and then absolutely you're gonna have some fever with RSV. Okay. Most important thing in terms of treatments and how to take care of this is it's not really. It is important to know what kind of virus you're dealing with. Okay, especially if it's COVID, because there's rapid tests out there. For most of these other ones like RSV, influenza, a common cold, you're not gonna be able to test that. You don't know whether you have one or the other, right? But for COVID-19, it's easy. We have COVID test here, right? With COVID-19 as well, there's vaccines and there's also treatment like Paxlovid. And RSV, there's vaccine. Influenza, there's vaccine. The common cold, no, there's none. Okay, just remember that the most important thing to recovery and how to kind of deal with your symptoms when you're dealing with these infections, you gotta take it symptom by symptom, right? For example, you have fever, you're gonna take Tylenol. You have cough, yeah, you take some Robitussin, right? It's all symptom management, and a lot of it has to deal with increasing your fluids and then resting and basically go to sleep, right? Take a rest. A lot of us work many hours. We deal with a lot of stress on a day-to-day basis. That compromises our immunity and we end up picking up this infection. Okay, so when you are sick and you are compromised and your health is at risk, you need to increase your fluid, go and rest more, right. When you call off, hopefully when you do call off, what you need to do is take rest, right. Go at home, sit at home, watch TV, whatever, eat some soup, get some rest, because next week you're probably going to be working whatever 12, 16 hours that we're doing, right. If you're nursing, we all work so many hours, and so if you're compromised, you're sick, I urge you to increase your fluids and increase that rest. You need to get some rest. Okay. um any questions on these? You can choose to keep this, guys, if you want. Otherwise, you can bring it back to me in terms of these handouts. Let's go over the test real quick. Okay, let's go over the test here. We got a couple questions here. What is the best way to stop the spread of infections?
Hand washing.
Hand washing, guys. All right, you're gonna rub it in your eye. You're gonna rub it in your mouth. You gotta inhale these viruses, and you're gonna get sick. Okay, and the more of these, you remember when COVID was here, they say that if you're in an infected room, try to lessen your exposure to the sick patient. And that's the same thing that I was telling you. The more viral load that you're exposed to, the greater risk if you are getting infected. Same thing, when you're not washing your hands, you're constantly putting your finger in your mouth. You might not get sick right away, but the more times you do that, you are going to get sick. Okay, so washing your hands is the number one way to stop the spread of infection. Okay, COVID-19 is a type of influenza virus. Is that true? Is that influenza? Is COVID-19 the same as influenza? No, they're different. They're different viruses. RSV, the common cold, um, COVID-19. All of these are all different. List three symptoms of positive COVID-19. What are some symptoms that you might have with COVID-19?
loss of taste,
Loss of taste,
difficulty breathing,
cough, difficult breathing sometimes in severe cases, um,
Body aches,
body aches. Sometimes, yeah, seldom, yeah, sometimes.
fever,
Fever,
sore throat.
loss of smell, sore throat sometimes, yeah. There's a lot. It's pretty much a lot of it is the same as the influenza or cold. But definitely the ones that stands out the most with COVID-19 is going to be loss of taste, smell, and headaches and all that. That's all neuro stuff. What should I do if I have symptoms relating to COVID-19 in relation to work? What are we going to
Take a
do?
test and tell your supervisor.
Yeah, don't come to work.
Well,
Make sure
show
if
up
you're
there.
having symptoms of these and you don't know whether you're positive or not, just grab a test. Or even if you come here and just say, hey, you know what, Sam or John, I have these symptoms. If you have, trust me, if you have a fever, we're not letting you into work. Okay, if you have a fever, take a day off, and then you're gonna have to take a test, right? Depending on how severe your symptoms are, you might take a couple of days off, or we're gonna kind of order you to take some days off. What should I do? Oh no. Current treatment and vaccine for COVID-19 is now available for public use. When we first started this in-service a couple years ago, we didn't have any kind of treatment for it. We didn't have any kind of vaccine. So our answer to this before a couple years ago was a no, right? We didn't have anything, but now we do. We have, and in fact, COVID-19 we just see it as a common cold because everybody gets COVID-19 now, right? All right, and then also, guys, once you get infected with COVID-19, you have these immunity from it. So even though you are going to get sick, your symptoms are going to be less, right? And your body basically has been to it before, and it notices the virus, it knows the viruses, right? And it produces enough white blood cells to lessen the time frame of when you're sick. Okay. Remember, incubation period. Incubation period is the time when you're exposed to the time when you show symptoms of sickness. So it could be the time that's kind of similar to like infectious period. It kind of overlaps when you're infected. Okay, so when you're, for example, if you're exposed today, you're not going to be sick today. You're not going to be infecting people, right? So, but 2 days from now, you might start showing symptoms, and that could be the incubation period for was today until you showed symptoms, and then your infectious period um, it's hard to tell because once your body starts producing, starts building up the viruses, starts expanding more and more viral load, that's when you're really infected. Okay, so for example, if you show symptoms today, 2 days ago when your body was exploding with viruses, you were infectious 2 days ago despite not having symptoms. Okay, and so you could be infected for up to 14 days with COVID-19, and then with influenza up to 7 days. Just remember that if you've been sick for 14 days and you're like still having symptoms, coughing, it doesn't mean that you're infectious, right? You can still have symptoms and not be infectious. Okay, so we're gonna count the day you were sick, first day you had symptoms, 10 days, and within 10 days usually you're no longer infectious. You can still have coughing, you can still have phlegm. Okay, it doesn't mean that you're sick. We're probably going to bring you into work. Okay, here at Seacrest, we're going to follow a policy that if you're sick with COVID-19, you're going to take 5 days off and then you wear a mask and you come back to work. Okay, we know exactly how these viruses kind of work and when the time frame is when in terms of infectious period. So we are going to try to protect our resident and staff. So we're going to try to figure out when to bring you in, in a safe manner. Okay. Common cold is the same as the flu. Is that true? Is if you have the common cold, would you say to your supervisor that I have the flu? No, they're two different viruses. Okay, and the flu is more significant than the common cold. I have the cold. Okay, I might have a cough. I might have, sometimes a fever. But influenza is going to hit you harder. It's a more complicated virus, and these are the viruses that will get your residents sick, go to hospital, get pneumonia. Okay, so it's more complicated and it's more significant. Let's put it that way. Okay. In fact, influenza has a more ominous record because it's been around for longer. So there's more people have died with influenza than COVID-19 because we've been dealing with it for a long time. All right, incubation period can also be known as the infection period. That's true. Okay.
Forgot 8.
8, 3 or more. Oh yeah, 3 or more cases of COVID-19 in a facility is considered pandemic. Is that pandemic? No, it's an outbreak. It's an outbreak. It's an outbreak. Pandemic being refers to global, issues, right? And then an outbreak refers to one location, just us, right? Like we can have an outbreak here. It doesn't mean the whole city is gonna have an outbreak, right? All right. Frequent hand hygiene and avoiding touching my face and eyes are considered essential to stop the spread of infections. That true or false? True. Okay. If I have respiratory illness, what is the most important steps to recovery? What do you want to do when you're sick?
Lots of rest.
Lots of rest and increase your fluids, right? Drink a lot of water and take a lot of rest. Have your husband or your boyfriend, whatever, take care of you, right? All right. Any questions? Okay. All right. That's it, guys. Hand me over your test, and then we will meet up again tomorrow. Okay. Make sure you guys are signing in. This is for your CEUs.
We're having another thing tomorrow?
No, that's it. That's it.
Oh, you meant
Yeah.
Okay,
All right. Thank you, Sheila. Thank you, Julia. Martha, thank you.